Hello, everyone, and welcome to Transforming Interdisciplinary Pain Management Education across Australia. This is a webinar as part of National Pain Week for 2024. Before we get underway, we'd like to do an acknowledgement to country. Chronic Pain Australia acknowledges the traditional custodians of the lands in which we live and of the many different nations across Australia. We pay our respects to elders past, present, and emerging, and the holders of the memories, traditions, cultures, and spiritual well-being of the Aboriginal and Torres Strait Island people across the nation. We acknowledge any sorry business that may be affecting the communities as a whole. Today, we will be discussing Open, which is an online e-learning clinical pain management training program, which will be launched later this year for all health practitioners across Australia, with the intention of improving the lives of those who live with chronic pain. Today, we have a panel which has been involved from a range of clinical settings and expertise, including lived experience. Professor Michael Nicholas is leading this project, and Professor Michael Nicholas is a clinical psychologist with over 40 years of experience in the field of pain management. Professor Helen Slater is also a clinical researcher and recognised as a specialist musculoskeletal physiotherapist, dedicated her career to developing capacity-building activities in musculoskeletal pain and health to have real-world impact. Fiona Hodson, for those who would be familiar with Chronic Pain Australia, be well aware of Fiona. She's a pain management clinical nurse consultant who's worked in public tertiary pain clinics for over 26 years with expertise in all aspects of pain service delivery. And last but not least, we've got Joyce McSwan, who's an award-winning pharmacist who's specialised in chronic pain and developed innovative chronic pain models of care that have been life-changing to many Australians who are living in pain. Myself, I'm going to be the host, I guess. My name's Brent Headley. I'm an ambassador for Chronic Pain Australia, and having previously served Chronic Pain Australia for 3 years as a board member. But anyway, we'll dive straight into it with our first question, and it's going to be directed to you, Michael. So I guess, as we said, you're leading this project. Can you describe Open and how it will help in terms of people who are living with chronic pain?
Yeah, thanks, Brent. It's a great pleasure to have this opportunity to speak directly to the many thousands of people living with pain across Australia. It's especially exciting for our group as we're keen to share news about our new project that we expect indeed to make a real difference to all those Australians living with pain, as well as their families and indeed their health care providers. So I should say a little bit about myself and my background. As you mentioned, I'm a clinical psychologist. I've been working with people in pain and their healthcare providers for over 40 years, mainly in Australia, but also in England and Southeast Asia. I've also spent several years on the executive of the world's main pain organisation, the International Association for the Study of Pain. And for the last 30 years, I've also been involved with developing and directing multidisciplinary pain management programs at the Royal North Shore Hospital in Sydney. This means, I guess, that I've seen firsthand many of the problems and experiences faced by people with persisting or chronic pain around the world. And what I've learned is that the problems are actually much the same, whichever country you live in. But there are major variations and differences, if you like, in your ability to access the high-quality pain services in different parts of the same country. And I'm sure many of you will have experienced this. You would have experienced long delays in getting to see multidisciplinary pain clinics. And we know those delays are worse for those living in more rural and remote regions of Australia. We also know it's common for people in persisting or chronic pain to feel almost invisible to many healthcare providers, especially if they say they can't find anything wrong with you or that you have more pain than they think you should have. At some stage, most of you will even have felt that many healthcare providers seem to believe your pain is all in your head, that you're imagining it, and you're only motivated to get more drugs or not going back to work. This, of course, adds to the burden of chronic pain. But what many of you may not realise is that pain education for healthcare providers of all disciplines has been generally lacking throughout their professional training. And we think this is a major reason why you have trouble getting the help you need with your pain. Although it'd be nice, no one realistically expects miracle cures for persisting pain, but it would also be nice to feel that your healthcare providers understand your pain and know something about how they can help you, and that they could acknowledge that your pain is real, is not imagined, and that loading you up with unhelpful drugs, sending you off for more investigations is really not the answer. And if they're prepared to work with you and other healthcare providers on developing a pain management plan that addresses your needs, then maybe you would get the help you need. Now, these are some of the reasons we want to tell you about our new project we call OPEN, which means Online Pain Education Network. It's been developed by a collaboration between experts in this field from across the country of several disciplines, with funding from the federal government. It's intended to provide basic training in a common pain management approach for all healthcare providers, regardless of their discipline. So it shouldn't matter who you see. If they've been trained in this method, they will follow the same blueprint, and irrespective of where they live or where they work. So it shouldn't matter that you're rural or urban and where you live. But basically, OPEN is intended to fill the gaps in the pain education of all healthcare providers. Now, if your healthcare provider is willing to complete the OPEN program, then we believe they will be well equipped to work with others in a comprehensive and consistent approach to your pain. And we believe that will make a real difference to your pain and its impact on your life. And that's what OPEN is about. It was developed to improve the ways in which healthcare providers can improve the lives of people living with chronic pain. And the others will say a bit more about it next.
Thanks very much, Michael. That's a fantastic overview. I think at this point we'll throw to Professor Helen Slater. Helen, it'd be terrific to better understand how the OPEN training reflects the current pain care strategies and priorities of people who live with chronic pain. And I guess as part of that, it's also worth you going into a little bit more detail in terms of the consultation with consumers and how this feedback has been incorporated into the OPEN training.
Thank you very much, Brent, for that question, and also thanking Professor Nicholas for the introduction to the program. So this is a really important initiative, as Prof. Nicholas has outlined. The difference in this program from other training programs about pain management really comes to the point of understanding from those with lived experience what's most important from their perspective when they seek care for their chronic pain. What do the health professionals need to be able to do? So if we look at traditional training, that's a lot about the evidence of various interventions. But if you look carefully, the person with lived experience is not at the center of that. So we were really interested in flipping the training lens around, coming back to ask Australians all around the country, what is it when you seek care that most matters from a health professional perspective? And so that level of engagement allowed us then to understand right across that sort of 16 to 91 year age group, what are the things that matter to you? How can we synthesize those down into training targets and then embed those in our training to make sure that the care you're getting is what's needed and wanted? So in principle, we undertook a study that really derived a framework with people with lived experience and carer input. We asked them from that framework which of these things are most important, and we ended up with a framework of 9 key, what we call training targets. And for example, they're things like validating me and my experience of pain, communicating with me, listening to what I say and learning from me so I feel heard and supported, So in principle, what we've then done is taken that framework, we've gone to other health professionals who work in the area, and we've said to those health professionals, you're well experienced, you understand this area. Can you look at this framework that's been derived and tell us what you think is most important from that framework as well? And in principle, what that's meant is we've got a mirror image where we can show that both people with lived experience and those who are dealing clinically with those with lived experience mirror each other pretty well. And so we've then built the content, strongly positioning the person at the centre, dialing up our training around communication, empathy, validation, in line with contemporary evidence to strengthen the interdisciplinary training model. So I think the key message out of all of that is taking on board what people across Australia have told us really matters, what carers have told us mattered, and also those working in the space have confirmed from the health professional perspective matters. And we've brought all that together to underpin the training. So as far as we know, we think it's the only program, not just in Australia, but around the globe, that's really put the person right at the centre of the training efforts. And that's the key.
Incredible. Thank you, Professor Slater. And Fiona, you're on the expert advisory group for this project. Referenced your experience a little bit earlier in the intro to today's session, but could you please explain the value of, I guess, the open training from a bigger picture perspective, including society, but as well as the healthcare professional and consumer perspective? Be terrific to get your insights in this space.
Yeah, thanks, Brent. Yes, as we know, chronic pain affects about 1 in 5 people in Australia, and it impacts all aspects of their daily lives. So we're estimating that's around about 3.6 million people. And this is projected to be much higher with our ageing population and people having multiple medical morbidity and complexity. So it's a large social issue, and the impact is very, very big there. So people living with chronic pain experience much higher rates of depression and anxiety. There's loss of income, disability, stigmatisation and isolation. So all of those issues which we have, picked up with our National Pain Survey year upon year, that's why it is such an important issue, and this program is such an important opportunity for us to upskill health professionals to better manage people with chronic pain. So healthcare practitioners often do lack that knowledge and also confidence and skills to manage people with chronic pain effectively. So what Helen has just said before that we think is so important about this program is the fact that it's about looking at the lived experience of the person with chronic pain, and it's patient-centered approach. So it was developed as part of this co-design, and as I said, the importance of consumers, carers, and health professionals from multiple health disciplines. And Helen's already alluded to the various quotes about listen to me, learn from me, and hear what I'm telling you. But there's also that other approach of nothing for me without me as well. So this training program is hoped to improve the knowledge and confidence and skills of those health professionals. And as Michael had alluded to as well, it's accessible because it's via an e-learning platform and will be available to all health professionals across Australia. So Open is practical. It's a flexible interdisciplinary e-learning training program for these health professionals across Australia. So that can include GPs, medical specialists, nurses, physiotherapists, clinical psychs, OTs, dietitians, exercise physiologists, anyone really from that health background. And its evidence-based approach also focuses on this patient-centered approach, and this allows them, some autonomy, but also working with the patient and their goals. So ultimately, the training will help, we think, improve the lives of people living with chronic pain. It will help empower the patients to look at other non-pharmacological approaches for their non-specific chronic pain condition. and hopefully it will it's been developed to minimise the impact that patient has on these individuals' lives, and allow these patient voices and the unique needs of all of these modules. So it'll help those health professionals to, help set up goals with these patients and help them manage their chronic pain. So I think if you're a consumer and your health professional, you don't feel like you're being heard or listened to, is maybe you should nudge your health professional and ask them when this is launched later in the year, are you aware of the Open Health program, so that they might be able to get on and learn a few extra skills there.
Thanks, Fiona. And we mentioned at the start of this session that this is a consortium project funded by the Australian government. So in addition to developing open training, we also understand that the Australian Pain Society and the National Ageing Research Institute has developed a Train the Trainer pain program for staff, and particularly those in residential aged care homes. This is called Pain Act. Joy McSwan joins us today, and she's been leading this project. Joyce, do you want to take this opportunity to provide us with a bit of background of Pain Act, provide the audience with an explanation, and especially how it addresses what is a current problem in Australia?
Yeah, absolutely. I mean, there's no doubt, there is an aging population. There's a great need within our aged care sector. And fortuitously, currently as the president of the Australian Pain Society, I had the wonderful pleasure of being, able to participate in the closing act of the Pain Act that we've been working on with the consortium for the last 3 years. So it's been handed over a couple of precedents here now. However, my earlier training in pharmacy world was actually in aged care. So it was very nice to sort of come back to not just pain, but a really passionate area of mine, which is aged care, and an area very close to heart. And this is quite unique in terms of the trainer, because unlike the fact that there's, nursing training that we kind of know of, and there's been a lot of work done independently in those areas, what we find is this Train the Trainer is actually quite appropriate for those who are really at the front line of the patient care, which is for the carers. Sometimes they call them personal carers or personal care assistants, and they are so important, but often they miss out on appropriate training that is conducive for them, their work schedule, how much time they have. So in collaboration with NARI, which is the National Ageing Research Institute, we combined our efforts in producing this called Pain Act. And this is actually now available on the Australian Pain Society website. And the word ACT stands for Aged Care Training. So this is now online. And it's also based off the earlier, the foundational work, actually, which Fiona had a lot of hand in when she was within the Australian Pain Society, which is our residential aged care facility resource. So it does use that as a really good backing resource, and our toolkit as well for aged care. So it comes with a lot of good patient-centric, but within what we call a biopsychosocial model. So it's looking at the whole comprehensive care for someone who has pain and is also aging. And what it brings the awareness, most importantly, to registered nurses, to personal care workers, so that they can better identify pain in their everyday setting. What is also awesome about the Train the Trainer program is that it can be in-house. So again, it saves the residential aged care facility money to be able to go out there and find resources. Well, they can literally do it from the website itself. There's an opening module, an intro module, which teaches you exactly how to use the modules. It's got short videos to watch across the 8 module topics, and they're really short bite size. So just 10 minutes. And this is all in consultation with the workers at this front line, asking them what's going to work for you. Because the last thing we wanted was to create something that was going to be long, boring, and then no one has time to do it. So it can be very much bite-sized and sequentially or non-sequentially. So the whole idea is to cover a nice myriad of topics, from assessing pain, dementia care, non-drug ways of managing pain, how to use medication safely when it's appropriate. So all in all, we are so thankful for this opportunity to bring this unique product to the hands of the frontline workers, and also to nurses within aged care facilities. But I can also see it being used in NDIS settings and things like that, where there are carers who aren't necessarily always nursing trained either formally. So this is very adaptable as well. So yeah, very happy to be part of this, and it's live, ready to go. So if you're an aged care worker, or you've got aging parents, or you've got friends, family in this area, in this sector, this is very appropriate for them. And yeah, please share the word for it to be used.
Brilliant. Thanks, Joyce. And just to reinforce the point you made there earlier, that this is currently available on the Australian Pain Society website. So terrific resource for those who are interested to go and check that out. I guess we're sort of at the stage now where we're close to wrapping up. But before we do so, I'd just like to circle back to each of our presenters today for an opportunity for them to perhaps reinforce one of the key messages that they put forward, or add some additional points that they may have come across in today's discussion. So perhaps, Michael, off the top, is there anything you'd like to add?
Yeah, no, I think you've had a pretty good overview, and I don't want to complicate it too much, but I think you can see we've got a nice blend, we believe, of information and input from experts with many years of experience in the clinical side, but also, as Helen outlined, really almost unique sort of input from people with lived experience of pain. And I think this makes it really does make it extremely unusual in this world of experts telling everyone what to do. So we are trying to do what we preach of working with people, but importantly, it's multidisciplinary. We don't believe any one professional is going to be able to do everything, but what we want to be able to see is if a GP is out in the country setting and they've got a practice nurse, that they could run a service using Open. They don't have to refer people into the city to get this sort of care. So this is what's going to make it much more attractive for people across the country. So we can't just rely upon specialist services in the city, and that's what this is aimed at, is spreading the knowledge and the skills, and helping people develop the confidence to use them.
Yeah, certainly. I think that access is a key element, obviously, and being a digital product, the opportunities that it opens so much for those who need it so much. Fiona or Helen, would you guys like to add anything else?
Just like to say how grateful we are from the consortium in developing this training, for the incredible generosity and value add from those people who contributed what matters most to them, so we could sort of shape the training to directly respond to that. So I think that's very important that we provide that acknowledgement, because we couldn't have achieved this without that input. So thank you to everyone who did contribute to that.
And again, I'd just like to say, from a Chronic Pain Australia point of view, this ticks many boxes from the online aspect of, addressing the rural and remote issues for many health professionals and patients getting access and equity of access. And as I said, this is the most unique program that I've ever heard about, where the patient is really at the centre of it all. And, as Helen and Michael spoke about, how the key principles and the framework was developed out of that lived experience. So I'm very excited and looking forward to the launch of Open and to promote it further.
Well, thanks very much, guys. That's a terrific summary. I think we perhaps should leave it at that point. The way Fiona wraps it up couldn't be said better. So I hope everyone enjoys Pain Week 2024 and gets the opportunity to jump online and check out the Open program. It's it's obviously a groundbreaking initiative and something with real utility and excitement around it. So thanks again for your time.